A miracle weight loss drug? Or a dangerous last resort made famous by influencers online? Ozempic is the latest social media superstar. But what exactly is it? What does it do? And should you sign up or stay well away? Clara is a relatively healthy person looking to get in shape quick. And she's just picked up her first dose of Ozempic. How is this gonna go? Well, let's explore the possibilities. Ozempic is a treatment actually injected once each week in the arm, stomach, or thigh. Clara chooses her arm, as it seems the least painful site. Once she injects Ozempic into her body, the drug swiftly dons a disguise, mimicking one of Clara's naturally occurring hormones, GLP-1, glucagon-like peptide 1. This hormone sends signals to Clara's brain telling it that she's had enough food to eat, that she's full, and that there's no more room. This effect is almost instant. Clara has her first meal after taking Ozempic. She feels full fast. Her appetite is gone. And with it, those pesky cravings for dessert. Something isn't quite right though, and Clara can sense an ill feeling when she thinks about what may lie ahead. You see, Ozempic contains something called semaglutide. This helps to regulate insulin by pushing the pancreas to create more of it, and it helps to lower blood sugar levels. This is not ideal, but Clara is well on her way to losing weight. She looks in the mirror and she instantly feels good. How about too good to be true? Because the effects Ozempic has on blood sugar levels are vitally important for a patient suffering from type 2 diabetes. They are the people that this drug was specifically designed for. Clara is not one of them. Her weight loss is just something that comes along with Ozempic. It's so effective at it though, Clara's thoughts about food have dissipated while taking the drug. She no longer daydreams about her favorite snack. Clara isn't even counting down the hours to her next meal. But hold on, because in addition to Clara's loss of appetite, she's experiencing something a little less pleasant: abdominal cramps and vomiting. Clara is also noticing her anxiety levels rising. Wrinkles are appearing on her face as though she's aging each daytime she injects Ozempic. Is this just a side effect that will pass, or is Clara putting her health in serious danger? Maybe Ozempic isn't such a miracle worker after all. While this new drug is undeniably effective at shifting any unwanted pounds from a person, it has not been tested as a drug for weight loss. In fact, it hasn't been tested on people who don't have diabetes, or people who aren't severely overweight. That hasn't stopped the drug from taking a hold on social media. Search your feed for weight loss advice today, and you're guaranteed to find an influencer promoting the miracle workings of Ozempic. Celebrities are on board the hype train too, with some stars taking the drug to get in even better shape. This is not what the drug is intended for, but it works. So how bad can that really be? The truth is, it can be disastrous, and not just for Clara. Let's look at the fine print that Clara wishes she'd have read before injecting Ozempic into her body. It's the drug that can leave you looking like you've recently finished a 6-month diet of avocado salads, broccoli, and brown rice. But the reports are in, and Ozempic officially comes complete with some serious side effects. Looking to lose weight and possibly increase the size of your pancreas to a dangerous level? Give Ozempic a try. How about a lucky dip with the possible prizes of constipation, vomiting, or diarrhea? With Ozempic's side effects, you can actually get 1, 2, or all 3. This new weight loss wonder also comes with a risk of lowering your blood sugar. Because hey, this was made for people with diabetes. But why should they get to have all the fun? Ozempic may also alter your vision, but you'll be looking good. Other people will be able to see you, so why would you need to look in the mirror? So, are you ready to say bye-bye to the body you currently have and exchange for a slimmer, but most likely less healthy version? Cross your fingers that you don't get one of the possible severe allergic reactions too. hope you don't suffer malnourishment, and you'll soon find out if Ozempic is right for you. Despite what social media wants Clara to believe, Ozempic is not the best way for her, or any other healthy person, to lose weight. She's now learning of the side effects firsthand, and while these effects are not guaranteed, because the drug has not been extensively tested yet, symptoms like those Clara is experiencing are being widely reported. Social media didn't give Clara the big picture either. While personal anecdotes are appealing, they should never be enough evidence to start injecting yourself with a new drug you know very little about. Some social media groups even have rules about posting within them that ban people from talking about the very real negative side effects of using Ozempic. It's undoubtedly concerning, particularly when you take into account the body image issues affecting people around the world that often come hand in hand with overexposure to social media. What about an alternative? One that contains the same semaglutide that's in Ozempic? One exists. It goes by the name of Wegovy, and it's even made by the same company that produces Ozempic. Wegovy actually contains a higher dose of semaglutide, making it more effective at helping its patients to lose weight. The big difference between Wegovy and Ozempic, though, is that Wegovy is approved as a treatment for weight loss. There we have it, the perfect alternative. We can all put Ozempic back on the shelf. The problem is, when Clara heads to her local pharmacy ready to get her hands on some Wegovy, she finds out that, unlike Ozempic, Wegovy is not covered by her health insurance. Clara doesn't qualify for insurance coverage for Wegovy. So, guess what? She's looking at a bill of over $800 every single month for the treatment. On the other hand, Clara only pays around $25 a month for Ozempic thanks to her insurance. Given that a person cannot get Wegovy on insurance, you can see why people are turning to Ozempic as the alternative. Clara is already stomaching the cramps and the rushed visits to the bathroom, but she's losing weight, and Ozempic seems like her only option. Despite the fact that experts do not recommend the drug as a treatment for weight loss alone, Clara continues to inject Ozempic into her arm. The drug now has a chance to cause multiple problems far more serious than just financial struggles. But things get even more problematic because Clara has a friend, and he is greatly affected by her choice to take Ozempic. Meet Mark. Mark has type 2 diabetes, and recently, when he went to get his repeat prescription of Ozempic, the pharmacy was all out. With the trends taking over, a shortage of the drug is now in effect. And Mark is incredibly frustrated because he's seeing people on social media using a drug that was made for people like him, and these people using it online don't really need it. For Mark, Ozempic keeps him healthy. It makes living with the condition of type 2 diabetes that much easier. But for all the influencers on social media and those blindly following the trends they're pushing, Ozempic is all about vanity. Let's be clear. Ozempic can be and is intended to be used by people who are morbidly obese, people who are at serious risk of health problems due to their weight. Those health risks outweigh the risks of taking Ozempic. Plus, Ozempic has been tested on these types of people. Mark has no problem with those people using the drug that he's desperately trying to get his hands on, because he understands that those people need Ozempic in order to have the best chance at a healthy life, just like he does. The worst part? Mark doesn't even know that his friend Clara is essentially stealing his treatment. This scenario involving Clara and Mark is not just a fantasy. Taking Ozempic when you don't need it is bad not just for you, but for others as well. There are actually many type 2 diabetes patients now unable to get their medication as a result of the rise in Ozempic's popularity. If you're not morbidly obese and you're not suffering from diabetes, the best way for you to lose weight is to make lifestyle changes. Switch up your diet, head to the gym, or increase the amount of walking you do every day. Another reason to remove Ozempic from your shopping list is that while it may cause you to lose weight, that weight will almost certainly come right back once you stop taking the drug. That means Ozempic forever. which could also mean vomiting, diarrhea, and a risk of pancreatitis forever too. Experts are warning people away from this drug, but that doesn't mean that Ozempic's development won't lead to a safer alternative for weight loss. Right now, the drug needs to go to those who need it, and as that happens, the risks of dangerous side effects drop right down. And we all get a little bit healthier as a result. Thanks for watching, and if you enjoyed the video, please give it a like and subscribe to the channel. And for a much safer injection than Ozempic into your arm, go with knowledge into your brain with this video about the limits of the human body. It's guaranteed to amaze.